Hi, my name is Lindsay McGee and I am the waiver manager at the Bureau of Developmental Services, BDS. These recorded training sessions are intended to provide information on each service available on the Developmental Disabilities, DD waiver, Acquired Brain Disorder, ABD waiver, and the In-Home Supports, IHS waiver. In this session, we will be discussing specialty services. We will describe the service, talk about a scenario, and then provide any additional information that may be important to know about the service. The information in this session is applicable to the Developmental Disability Waiver and the Acquired Brain Disorder Waiver. How do the DD and ABD waivers define specialty services? Specialty services are intended for individuals whose medical, behavioral, therapeutic, health, or personal needs require services which are specialized, pertaining to unique conditions and aspects of developmental disabilities or acquired brain disorders, and consist of one or more of the following: assessment, consultation, design, development, and provision of services, training and supervision of staff and providers, and evaluation of service outcomes. So what does this mean and how does this help me achieve my goals? Specialty services are designed for people with specific medical, behavioral, therapeutic, health, or personal needs related to the supports needed to live a good life. This could include things like skill training and development, interview and observation with individual and team to identify needs, participation in team meetings, and training for team members. This could also include therapy and behavioral services. So that could include individual therapy, group therapy, or behavioral consultation, which could include a behavioral support plan training and updates to a behavior plan. This could also include assessment and consultation. So this could be initial development of a behavior support plan, risk assessment and risk management plan, things like a neuropsychological assessment or a fire psych evaluation. Now we will walk through a fictional scenario of an individual who is accessing specialty services. Jake is a 32-year-old man with a developmental disability who relies on supports with daily living skills and social interactions. Recently, Jake has been experiencing increased anxiety and difficulty managing his routines. His family is concerned and wants to support Jake in accessing specialized supports. So how does Jake access and use specialty services? Jake and his family called his service coordinator and discussed accessing specialty services under the DD waiver. The process began with an assessment by a team of experts, including a psychologist and an occupational therapist. This assessment identified Jake's specific needs. Following the assessment, the team held a meeting with Jake and his family to create a personalized plan. This plan includes services such as anxiety management therapy, life skills training, and social skills workshops. The team also provided training for staff to ensure Jake continues to have his support needs met. So what is the outcome of this service for Jake? After a few months, Jake showed significant improvement. His anxiety decreased and he became more confident in managing his daily routines. The life skills training helped him become more independent, and the social skills workshops improved his interactions with others. Lastly, we will discuss any potential service limits and requirements that must be included in the individual service agreement. We will also discuss if this service may be provided remotely or while in acute care. When a service can be offered remotely, it means you don't need to be physically present at a specific location to use it. When services can be accessed in acute care, it means that individuals who are in a hospital or another urgent care type facility can still receive these important services. When waivered services have limits, it means there are specific restrictions or caps on the type, amount, or cost of services that can be provided under a waiver program. There is no service limit outlined for specialty services. This service may be provided remotely, and it may also be provided in an acute care setting. For requirements in the service agreement, there must be a description of specialty services outlined. Thank you. If you have any additional questions regarding specialty services, please email bds@dhhs.nh.gov.